Yesterday, I attended a disability summit in Pittsburgh, which was hosted by our friend and colleague, Representative Dan Miller. Many of the members here today also attended.
And so did I. It was a good conference.
And we heard your presentation. Very good. It was an excellent event with lots of bipartisan enthusiasm for human services and in helping our brothers and sisters with disabilities. The collective passion for the human services mission was very encouraging. But the painful reality is we must appropriate and pony up the resources needed to fund this critically important mission and function of state government. When we decide to cut or to not pay for human services as we should, the costs don't disappear. They're shifted. When more individuals who experience mental health challenges are entering our jails and remaining there for longer than the average inmate, and many times for minor crimes, we have a serious problem. The problem is twofold. It's a human services problem, and it's now a corrections problem, having to do with public health and safety. In the 2021 budget, I'm hoping that we'll fulfill our responsibility and duty and provide the resources that counties need to provide the mental health services and all services that are needed. Pennsylvania's mental health system is moving full speed towards a crisis. Programs are closing. Providers are turning in contracts, and all the while suicide rates are rising and wait times in emergency departments are longer. People with serious mental illness are becoming stuck in county jails, many times for low-level crimes, and this is a great misuse of our finite resources and is not cost-effective in terms of mental health nor public safety. The mental health dollars allocated to the counties have not had a true cost of living increase since fiscal year 2007 and 8. Imagine trying to run your household budget if your salary did not increase for 13 years. There's a lot of things you would need to cut and a lot of tough decisions you would need to make. Pennsylvania counties hold responsibility for specific mental health functions as described in the Community Mental Health and Intellectual Disability Act of 1966. Today, there's approximately 1,025 people being served in state hospital civil sections. The provision of services for individuals with complex mental health needs has largely shifted to our counties. The state has transitioned dollars to the counties, but not at a rate that has kept up with the increasing costs and the complex needs. Services are struggling across the board. Counties have had to close programs because of insufficient funding or because programs experience quality issues relative to financial struggles. Agencies have had to cut staff or decrease the quality of staff they hire. Providers are beginning to give notice on their contracts. Health Choices, the state and federal Medicaid funding system, pays for clinical behavioral health services based on medical necessity criteria. The county mental health funds pay for supports and clinical services not covered by Health Choices, Medicare, and private insurances, and for our Pennsylvanians, our brothers and sisters who do not have insurance. County mental health programs are shrinking and closing. Mental health programs that assisted individuals with complex needs in 2007 simply cannot operate for the same amount of money in 2020. I represent part of Philadelphia and part of Montgomery County. In Montgomery County, we've had a significant loss of our services since the last time there was a COLA in 2007. We've lost 5 vocational programs, 2 moderate care residential programs, 1 bridge housing program, 2 supported housing programs, 1 mobile co-occurring mental health, drug and alcohol support service, 4 peer resource services, 1 volunteer matching program, 1 mobile psychiatric rehabilitation-based program, and others. So what's needed? For the 2020 state budget, our friends from the County Commissioners Association are asking for a minimum increase of $42 million to the mental health county base allocation funding line to shore up existing services and capacity needs. This will help counties to ensure that the safety net of services already in place is strong and sustainable prior to adding additional programs and services. We saw this not too long ago when the Commonwealth enacted assisted outpatient treatment, a program that allows someone to be diverted by civil commitment to treatment. Instead of ending up in the criminal justice system, they're able to go to see a judge and, I hate to use the word ordered, but to go to therapy maybe once or twice a week at the behest of their loving and supportive family so they don't end up in the criminal justice system. Not one county in Pennsylvania has opted in to the assisted outpatient treatment program, even though it's a great program, simply because they do not have the resources. We don't believe it costs any extra to do it, but they're already overburdened.